Well, we all like to joke a little bit about snoring and how annoying it can be and so forth, but it is really no laughing matter because snoring can be indicative of a much worse problem. In fact, it can be a matter of life and death. Dr. Paul Coleman is here this morning to talk about something called obstructive sleep apnea. Correct. So what is it and how does it present itself? Is it just as simple as snoring?
No, when the tissue in the back of the throat, especially maybe if we get a little bit heavier, gets lax and loose, it actually collapses against the back of the throat, which is the thinnest part of the entire airway. And when that occurs, you get a shut-off. Your air is not leaving your body. So you get a buildup of CO2 in your lungs. You stop breathing, basically. And as we go through the night, we're supposed to go through sleep cycles, stage 1, 2, 3 in REM, and REM is where we get the good part of the night's sleep. But in REM, you're supposed to be paralyzed. The only thing that's supposed to be working is your involuntary muscles, your heart and your lungs. So what will happen is you get this buildup of CO2 in your bloodstream. The brain says, wait a minute, I'm being poisoned here, and it activates some voluntary muscles in your throat to free up the obstruction. That will then yank you from this good part of the REM sleep to an earlier part of the sleep cycle. So you could actually have a patient that thinks they slept for 8 hours, but maybe didn't spend that 24% of the time in REM where our brain defrags and our muscles heal.
So this is where somebody, they might sleep for 8 hours and wake up and say, I'm just exhausted. I don't feel like I slept at all. This could be one of the things that's going on. Well, now, how common?
It's as common as diabetes. It's over 12% of the public.
It's a lot of folks.
It is a lot of folks. It's more common than asthma. And as we age and as a population we get a little heavier, it's becoming more and more prevalent.
Okay, then let's talk a little bit about the treatments for it then, because I recall my stepfather having surgery for this, and it was pretty drastic.
Right. There's always been 3 options available for treatment. One is surgery, which nobody in their right mind would go through unless they've tried everything else. They cut away the uveal little thing that hangs down, tonsillar areas, the back of the tongue, and frequently it can help, but not necessarily at all or for a long period of time. The more traditional recommendation has been something called a CPAP. Now, a CPAP is basically a gas mask that you affix to your head, and CPAP stands for Continuous Positive Airway Pressure Machine. And don't get me wrong, these things have saved a lot of lives. And what
my brother uses one, my uncle does. In fact, we were just on a trip together, and we made the 2 of them room together because they both had their CPAP machines. Right. And it looked like an intensive care unit.
Well, it blows you up like a balloon, so it stints the airway open with positive pressure. And the problem is that 40 to 80% of the people that are given these machines won't wear them, are non-compliant, get up in the middle of the night, don't want to try to strap these things back into place. So the third treatment option's always been some type of oral appliance. And there's hundreds of them available. We custom make devices in my office specifically for people that are non-compliant or have mild to moderate sleep apnea problems and really don't want to get involved with the mask and the garden hose attached to the pump.
So these are the oral devices then.
Correct.
That go right into the mouth.
Right.
And it's like a mouth guard, kind of?
Well, all oral appliances work on the same premise. If you take your lower jaw and you bring it forward, then it brings your tongue and your tonsils with it. It also involuntarily stints the muscles around the sides of your throat, holding your airway open.
Okay, but now I'm looking at this, and it doesn't look too bad. It certainly doesn't look as bad as the headgear that I wore with my braces when I was a kid.
Absolutely not.
So can you still sleep okay with this? Can you you can't eat with it, obviously, which you're sleeping, so who cares? But
actually, the advantage to this, most of the devices hold you in a location all night long. If you picture a mouth guard, you probably made for sports.
Right.
Make one for the top, make one for the bottom. Laminate the bottom one a little further forward, and you have the cheapest oral appliance you can have fabricated that could work. Problem with that is if you're a mouth breather or you're claustrophobic, your mouth comes open, you disengage from the appliance. Whereas this is a 2-part thing. It's not tethered together with elastics or springs or struts. So in all positions, whether you're open or closed, you can get up and have a glass of water, you can answer the phone. You can kiss with it. I wear one, not great, but you can do it.
But it can't be done. Okay, so there are several types, but yours tends to be much more sophisticated, much more customized.
Correct.
And much more practical. And the chances of compliance are a lot better here, it sounds like, as well.
Hugely more compliant.
So now, a couple of things that I want to touch on before we run out of time. People need to be diagnosed, and you've got a great way for doing that, and you're offering a special for folks to be able to take advantage of that as well.
Correct. I have a home testing device that fits on your head much like a camper's flashlight, little nasal cannula that goes in. It picks up your snoring, what positions you're in, when you get to REM, how long you stay there, oxygen desaturation. All the information's downloaded to a certified sleep physician who kind of reads the whole thing for me and makes recommendations. But the bottom line is, you know, on some truly huge individuals, maybe they're better off with a CPAP, but they're not better off than the CPAP that's in the closet they're not wearing.
Got it. So for the first 10 callers, you'll offer $50 off of the diagnoses.
Correct.
The sleep diagnoses. But then if they go ahead and order the appliance and do that through you, you'll give the first 10 callers $200 off of that device. Now, the thing that other folks are going to want to know here, though, is whether or not insurance covers that.
Insurance does cover it in certain circumstances. There's a couple of policies that won't. Medicare won't. But by and large, yeah. The only problem is if somebody's anxious to get rolling on it, now we're involved with medical insurance, so it's pre-authorizations, and so it can kind of drag out. So if somebody wanted this because they'd actually like to sleep with their wife again through the holidays, then we do offer a discount for people that want to get involved and just go ahead and get
go
it
ahead
rolling.
and launch it, dude.
Yeah.
Again, the first 10 callers, $50 off of the diagnoses program that'll let you know whether or not you're a candidate. And then if you go forward, $200 off the cost of the appliance. And custom fitted just for you. There's no two alike. They're all just made just for you as an individual. So hopefully that would solve your problem. But you won't know unless you go talk to Dr. Paul Coleman.
Look forward to it.
Always good to see you.
Very good, sir.
Okay, those phone lines are open, so give them a call. For more information, you go to san diego6.com and click on San Diego Living.